Hi, it's Jess. We're talking about diabetes today or diabetes mellitus today. And I'd like to touch on a couple different things here in this particular recording. We're talking about culturally competent care, and then we'll get into nursing management. Nursing management is going to be broken into a few different pieces. There's a lot of information in there. Culturally competent care for a client with diabetes, we have to understand that I need to share the screen. There we go. Okay. We need to understand when we're providing culturally competent care that culture has a strong influence on dietary preferences, meal preparation, and food consumption. So there are a variety of different cultures that have food as one of the central ingredients to celebrations. I had mentioned Thanksgiving in the last slide. There's also, like, when you think about birthdays and anniversaries and all sorts of different things, all sorts of these gatherings have food usually at them. And depending upon their culture, they may have specific foods that need to be part of the game plan. Otherwise, it's just not the same, and it's actually kind of a cultural violation. So there is a high incidence of diabetes in these following cultures: people with a Hispanic background, Native Americans, Blacks, Asians, and Pacific Islanders. I'm getting on a high horse for a half a second. This is not 100% genetically their fault. These particular groups of people have had a lot of different, I'm trying to stay calm. They've had a lot of different discrimination against them. They've been forced into the margins a great number of times. And when you're forced into the margins, you have to do what you can to survive. So when you're doing what you can to survive, you may not have the best food choices available to you. So that's one part of it. And then that impacts the genes. So my body composition was built in my grandma. My part of my composition, part of anybody's composition, your mom's eggs, when it comes to reproductive, your mom's eggs were built in your grandma. So I was built partly in my grandma, both grandmas, right? And so when you talk about people who have had problems with discrimination and who have been had significant problems with their socioeconomic status, you're not just looking at that person at that point in time. You need to go back 2 to 3 generations, because we're all carrying genetics from at least 2 generations ago. The other thing that we need to, so like I said, it's not just because of where they're at now, it's because what happened 2 or 3 or 4 or 5 generations ago when these people were discriminated against at that point in time too. So it's not just now. It's also genetic history. It's also important to consider food preferences when you're teaching about nutrition as well. So there are some people who maybe have a variety of different conditions, and there are certain foods that just not jive with their culture, or not only with their culture, but with their own bodies. So we'll need to be able to really have good trusting relationships with these people so that we can have open and honest discussions with them and be able to tailor that plan to definitely fit their needs. Part of doing that is the nursing management job. And part of doing that is having a good subjective assessment. So our subjective data comes from previous health history. Let's take a look. How are they doing with their infections? Type 2 diabetics get a lot of infections. So what's their infection history? What's their trauma history? Do they have a big old blow to the abdomen? How's their stress, pregnancy? Do they have chronic pancreatitis? Do they have Cushing's syndrome, acromegaly, family history of diabetes? What sort of medications are they on? Are they already on insulin? Are they already on corticosteroids or diuretics or phenytoin? Have they had any other recent surgery or recent treatment for stuff? How are their functional health patterns? What's their health perception? How are they doing metabolically? How is their elimination? How much do they move their body? How is their cognitive perceptual? Are they having numbness and tingling? Are they having itchiness? Are they having headaches? Do they have constant abdominal pain? How is their sexual reproductive system going? Are they having problems with impotence? Are they having problems with vaginal infections? Are they having problems with libido? How are their coping mechanisms? How is their value and belief system? And not only value and belief system like their culture, but how willingly are they to change their lifestyle? Can they make commitments to change their lifestyle? It's really hard to convert meat and potatoes, typical American diet peoples, to lifestyle changes if they don't want to do them. So a good subjective nursing assessment helps us determine that. As far as objective, gastrointestinal, we may have people who are having a hyperglycemic crisis will have a dry mouth because they are technically dehydrated. Even though they might be drinking all the time, they're either peeing it out or it's in the blood system and it's not actually in the tissue system being used. So you can be drinking all the time and be dehydrated when you have diabetes. And not like drinking booze, like drinking water. And are they having problems with nausea, vomiting? Do they have fruity breath? Fruity breath is a hallmark sign of ketones on board, which means if you've got ketones on board in the blood system, that means that you probably have lactic acid going. That means that you probably have the citric acid cycle. You have anaerobic metabolism. Your body isn't getting sugar to make energy. It's making sugar, or it's making energy out of that lactic acid cycle, the proteins and the fats. How's their neuro? Do they have altered reflexes? Are they restless? Do they have confusion? Do they have stupor? Do they have coma? Nerves don't have sugar reserves. They have to get sugar on demand. They don't have any sort of storage for that. Musculoskeletal. Is their body eating them? Basically. So if they have a long-term problem with blood sugar and insulin not being used appropriately, or a complete lack of insulin, the body will actually use muscle tissue to survive. Other possible diagnostic findings include electrolyte abnormalities, a fasting blood glucose level of 126 or more, oral glucose tolerance tests or random glucose levels exceeding 200 milligrams per deciliter, leukocytosis, problems with white blood cells, which is where the infections come in. Blood urea, nitrogen, and creatinine levels that are high because the kidneys are processing all that blood sugar and they're getting beat up with their capillary beds, their nephrons are getting beat up. Increased triglycerides, cholesterol, LDL, VLDL, decreased good cholesterol, decreased HDL, hemoglobin A1C above 6. Glycosuria is sugar in the urine, ketones in the urine, protein in the urine, and blood acidosis. I'm going to stop here and we're going to continue on with nursing diagnoses and going on from there in the next recordings.